So we'll start all our visits with a little bit of the massager to get the soft tissues loosened up, just to help allow for a better adjustment when we do our manual work. Then we'll start the treatment with using some of this vibrational therapy using an Arthrostim. And we use vibrational therapy to increase the movement at the joint level that we are contacting. So then after we do our joint work with the vibrational therapy, next we switch the head to a trigger point head and then trigger point all the paraspinal soft tissue. This allows us to loosen up the tissues prior to our manual adjustment, allowing for a better adjustment, better movement of the joints. We're going to adjust this right SI joint. So I want you to really just think of melting into the table, letting these shoulders sink, hips into the table, and deep breath out for me. Good. I'm going to take this arm, I'm going to snug this shoulder up a little bit here, and take a big deep breath out and just melt into the table here. Good. Perfect. All right, we're going to adjust the shoulder AC joint scapula here. So with this left hand, just loosely cup your left ear. And I want you to take a deep breath out and just let this shoulder relax into the table. Good. For this, we're going to do the same thing with this right side. Yep, so over the ear. And take a deep breath out for me, please. All right, Alexa. So for this one, you give yourself a big hug, squeeze really tight, and deep breath out. And drop into my hand. Again, one more time. All right, now think of just letting this left shoulder sink into the table. Same thing with this right shoulder. Feel a little bit of a stretch. You feel a little stretch. Good.